Okay, Sister Yapapa, I just wanted to answer your question about whether a test is needed for lupus. So I'll just go over a few things. First of all, what is lupus? So lupus, systemic lupus erythematosus, is what we call a multi-system disease, which is also autoimmune. So a few big words. Multi-system just means it involves multiple parts of the body: your face, the skin, your heart, lungs, joints, muscles. So many systems are involved. In fact, I've had people ask me, well, I went to the doctor with my finger. Why is he checking my heart? Or it's one of those diseases that explains why you might go to the doctor with a simple complaint, but they're going to check everything because of diseases like lupus. So what makes it autoimmune? So generally your body cells don't fight each other. They're tolerant of each other. But lupus is one of those conditions we don't really even have a cause. What causes it? It runs in certain families, and other people have no family history whatsoever. So at this point, the thought is that it's a combination of the environment, maybe something in our food, a combination of genetics and family history that ultimately give rise. So what happens? Imagine that all your body cells look like this Sharpie marker here. Then suddenly something happens and the body begins to recognize it as foreign, that your body should attack its own cells. So it suddenly, let's say the skin changes, or the covering or the internal part of each cell changes to look like this. And that is why it's multi-system, because it's all your body cells that have now changed to look like this. So the body decides, well, we don't know this guy, so let's fight him. So lupus is actually a representation of the body trying to fight itself. So we call it autoimmune, self-immunity. And we don't understand all the processes involved. So let me just go over it. So first of all, because of this autoimmunity, scientists have been able to come up with a test or a group of tests that measure this autoimmunity. In fact, to make a diagnosis, if those tests are negative, they include the double-stranded DNA, complements, and a few others. If they're negative, the diagnosis stops right there. You don't have lupus. But the diagnosis starts with that positive test. So what happens after that? So now you have a positive antibody. One of the more common things about lupus, I have a little model here to show you, is that it affects the joints, typically the joints of the hand. So people will say their fingers are hurting or slightly swollen. It almost looks like how it will be in rheumatoid arthritis. People wake up in the morning and they just can't get going because their joints are hurting, but it's mostly the small joints. Occasionally, people might have what we call osteonecrosis of the hip joints, but essentially a lot of joints are involved. So remember that. Then the other thing is the face. People get what is called like a malar rash, a butterfly-shaped rash. It spares the nasolabial folds, and there's this red rash. Some people get a rash on the back of their neck as well. So first of all, you got a rash, okay? So that's the face. So we've already talked about two systems, the joints and then the face. Then you come to the brain. Lupus can cause people to become psychotic. Like you would think they've gone, quote unquote, in our normal parlance, mad, or now we understand mental health. So it can cause psychosis where people start believing things that they shouldn't be believing, hallucinations, they're deluded, and they have to be admitted to a mental institution, and somebody has to think of it that could this be lupus? So it affects the brain. And also, talking about the brain, it can cause strokes, okay? Then it also affects the heart, which is what this, the write-up was talking about, looking at the heart. About 40% of patients with lupus will have heart involvement. Your heart is sitting right here. So what happens with the heart? The membrane surrounding the heart can become inflamed. It's called pericarditis. It's very common in patients with lupus. And if you were to open the heart valves can also develop something that we call Lehmann-Sachs endocarditis. There's no infection, but the heart valves look like they're inflamed. All the same autoimmune inflammation type of thing. And then patients with lupus also have a higher risk of getting a heart attack. Why? Because the same process is affecting the small arteries around the heart. So that's that. Also, it can affect the kidney. So let me just show you what the kidneys are. Sometimes it's hard to. So inside your body, at the back of your body, outside of your intestines, you know, those are your intestines. You take that out, you have these two kidneys that filter out urine. So this is a very common manifestation. Patients with lupus can develop a nephritis, and actually some may end up on dialysis because the kidneys are inflamed. Okay, the muscles can get involved. Now, 90% of people with lupus are women, so that's why it should concern us as women. And since the write-up came out this morning, I've had a lot of people telling me, oh, my nephew, my niece had lupus, my schoolmates, my classmates. So the bottom line is, in summary, this is what lupus is about. And let me show you one more thing. So patients with lupus can also develop a stroke. A stroke because the same issue that is causing the heart attack, where the tiny blood vessels around the brain can also develop disease, and so patients with lupus can develop stroke. Sometimes that's the reason why they get psychotic. So in summary, Sister Ya, I made this video just because of your question. Lupus is a multi-system disease that is also autoimmune. We don't understand why it happens. It's multiple factors. It runs in certain families. 90% of the people affected are women, and the diagnosis is not based on one thing. But you can't sit at home and diagnose your lupus. You need that initial blood test looking for I use this illustration, those antibodies against this changed cell. So the cells have gone from looking normal to looking abnormal, and the body forms antibodies against them. So that test first, and then the doctor now has to go through a series of things, looking at your brain, your heart, your intestines, your joints, your skin, the rash, and all those things to make a diagnosis of lupus. So let me know if this clarifies your question. And I think we need a lot more education on lupus, because each one of these things can be broken down into many, many factors. Thank you. This is Dr. Ayi. I made it because now Queen Mother, Sister Yaprapa, asked me a question. Do you need a lab test to make a diagnosis of lupus? Thank you.